Welcome to the Heart of It, where we take our listeners to the heart of healthcare. I'm your host, Dr. Victoria Lee, and I'm thrilled that for our first season, we'll be speaking with some of the exceptional people at Fraser Health that are at the heart of healthcare. I'm very thrilled to introduce our first guest, Dr. Akber Mithani. He's the Regional Medical Director for Long-Term Care and Assisted Living at Fraser Health. But in a short summary, he is a passionate advocate. He's a teacher, he's a researcher, and he's a, I think, transformative change agent in the field of geriatrics. Dr. Mithani, thank you so much for being here, and honored to have you.
Thank you so much, Dr. Lee.
Well, and I think the first question for me is what led you to the path of and career in medicine? Because sometimes I think we think of healthcare as not just a job, but really it's a calling. And I'm curious about whether there was that kind of connection to what you have pursued.
In particular, I was interested actually in seniors care right from the beginning.
Oh,
right?
Really?
Because of the fact...
That's a bit unusual, isn't it?
Yeah, it was for me. And it was for me because... I moved to the United Kingdom from Tanzania, where I was born. And when I moved, to the United Kingdom, I saw the same kind of themes.
Yes.
It wasn't that different.
Yeah.
The seniors population was always marginalized, and disenfranchised and marginalized. And so I grew up in a environment full of seniors, right? And a culture where we really valued, the seniors and their wisdom and so on and so forth. So for me, it was trying to say, why should we not do something that can actually improve the lives of the of the seniors that are within our own communities.
Yeah.
So that's really what drove me to this.
How would you explain what seniors care is?
It's a specialty, obviously, and it's really obviously age is a major component of it. Yeah. So if you go into technicalities, it's people 65 years and over. But really, seniors care focuses around those individuals that are that have become frail, right? And they are having challenges in their functional abilities, in their activities of daily living, in things that we take for granted, right? Mobility, being able to eat, being able to clothe yourself, being able to drive or not drive, or and then being challenged with multiple comorbid illnesses, that becomes very challenging, as far as their health is concerned and their day-to-day functioning is concerned. So that really is what seniors care is about.
And that's also interesting as how things have evolved over time, right? Because as you said, when we look at it from just age perspective, it's different than when we're looking at functions and what are some of the services that we can provide to ensure that there's highest function, highest quality of life in the community as long as possible. And I think sometimes we are encumbered by some of the discrimination or misnomers or misunderstanding of what that looks like, or preconceived notions of what that looks like. Can you tell us a little bit more about what that means when you're providing health services for seniors?
I think it's important to understand that seniors are really beacons of wisdom.
Yeah.
Right. I think, from the culture that I come from the faith that I come from, and even if you look at, for example, the indigenous population that we work with very closely, seniors are people who are respected, right? And deserve that respect, right? And for me, it's a privilege to care for seniors, not a burden.
Yeah.
And my frustration with sometimes the system is that I see a lot of people who look at seniors more as a burden to the system rather than looking at them as a privilege, to be able to care for them. The seniors in our society are folks who have contributed to society all their life.
Yeah.
Right. And now they've reached a stage in their life where perhaps they need a little bit more care. And I think they deserve that, right? They deserve the care that they need. They've contributed so much to society. And so now it's our turn, right, to really look after them and care for them. So I see it as a privilege to be able to do that and not as a burden.
Yeah.
And I'm so impressed with certain cultures. My culture, for example, the South Asian culture, has a very high esteem for seniors, as does the indigenous culture and so on and so forth. So I learn a lot from them. And I think we can learn a lot from their stories that they tell. And so I think that that's the stigma that we really need to, get rid of about seniors.
That's really interesting because in Canada, we live in such diverse cultures. I think one of the big assets or gifts of being in that diverse setting is learning kind of the strength of different cultures. And as you mentioned, seniors deserve that respect and care. And we would certainly want to have that as we age and in an aging society. And do you think that we can do something differently to have that intergenerational support, community support, societal support for our seniors? That, like, what would be kind of core to changing that narrative and changing that perception from what you see?
Yeah, I think that it's important that we continuously educate, our society and different people that we interact with. I think it's difficult, Victoria, right? I mean, I think every family, is different. Every story, every narrative is different. We have families, who are struggling in such a way that they wonder how they will even pay for medications, for their loved ones who may be seniors. And then we have families, who are seeking private, care communities. So every story is very different. I think we have in healthcare. I think we have developed. Sometimes I think we develop, a thinking about seniors as being, challenging to the system. Seniors are the ones that are blocking our beds. Seniors are the ones that are, not easily dischargeable back home. And I think that we need to understand that every person has a journey in their life, right? And that journey in their life means that they will need care at different, times, in different places, in different ways, right? And I think we need to be welcoming of that in our system. And our system needs to adapt to be able to address the needs of the people that we serve, in a continuum rather than in silos. And as when we start looking at things in silos, we start to compartmentalize people in different boxes, right? And I think that that's what we need to do. We need to get out of that thinking, and we need to start thinking about this as a system that's seamless around a continuum where people will need care at different times.
And that, I think there's a couple of things that I'd love to follow up. One is that kind of future and adaptation. What does that look like? And I think one of the things that you've shared with us before was sometimes as clinicians, we can think of ourselves as knowing what the patients or seniors want or need, or we're a bit paternalistic at times too, or can be. So you have an experience that you shared with me previously, I think was really touching. I would love to hear that story again.
Yeah, and there are so many stories like that. So this is a story of Gladys that you're talking about. Yeah, and it really hit me when I was practicing in long-term care, and I thought, I knew it all, and I knew what the seniors wanted. It was easy. I knew exactly what they want, and that's the kind of mindset that I had. And I shared the story of Gladys, who was 99 years old, turning 100 in about 2 months' time. And so I went to her and I said, Gladys, you're going to be 100 in 2 months. She was in long-term care, and she was very much cognitively with it. And I said to her that, I have really good news for you. You're going to get a letter from the Queen. Because the Queen sends you a letter every time you turn 100. And I said, isn't that exciting? I'm going to get the letter, and then we'll frame it for you, and we'll have a little celebration. We'll have cake. And she just looked at me, almost, tearful in her, in a way. And she said, I don't really care about a letter, from the Queen. Who wants a letter from the Queen? And she made a joke out of it. She's probably just as old as I am, And she said that, a celebration, what are you going to do for me? Like, you're going to have a piece of cake. You're going to have all these people in this care community around me that I don't even know, and they don't even know me. And she had no family at that time. So I thought to myself, I was doing something really good for her, and then, so I was excited to share this. And she said, so I said to her, what do you want? And she said to me, well, I'll tell you what, I'd like to go on a helicopter. I've never been on a helicopter ride. And ever since I was a teenager, I wanted to go on a helicopter ride. So I thought to myself, I'm not sure how I'm going to pull this off. But I thought to myself, I'll give it a shot, right? So I called Helijet, and I sort of said, I've got this person, and, she's in a care community, and, she's 99. And I was fortuitous because the person who picked up the phone was actually the manager of Helijet. And he said, bring her over and we'll give her a ride.
Incredible. And 80 years later, after her kind of always wanting to do that since her teenage years.
And so we had this, it was a huge day for her. The staff were fighting as to who should accompany her because we needed somebody to be with her. And we got her, dressed up. And I still remember the beautiful hat that she had on. And she went on the helicopter ride. And then for months afterwards, she would talk about it, right? And she had pictures, and it was on the wall. And she was so happy, right? So, what hit me at that time was I thought to myself, you think you know what they want, but you really don't. You don't know what they want. It was a similar thing that happened. It was Christmas time. I went to my care community and I said to them, they were all sitting in the dining room. I said, you know what? We've got this great, Christmas, lunch for everybody. And we're going to celebrate, and, it's going to be Christmas, and we'll sing hymns. And there was one table of some of the older ladies who were sitting down, and they just looked at me and said, Dr. Mithani, have you really had Christmas dinner here? And I said, no, I haven't. And they said, well,
sorry to tell you, but
it's not the best. And so I said, well, so tell me, what do you want? They said, we want to have fish and chips. And so we want fish and chips, and we don't want to have it in this care community. We want to go out and have it. So I called one of the fish and chips places.
There's a bit of a theme here.
Yeah. And I said to them, I want to bring these folks over for fish and chips, and this is from a care community. And they said, bring them over. And so we had busload of people
Wow.
go over to this fish and chip place, and it was chaos. But it was a lot of fun, right?
Yeah.
They were just eating away, and some of them wanted it in newspapers, and
Yeah.
they were just eating with their hands and making a bit of a mess, and the staff were there, but they had a blast,
That's
right?
what it's about.
And that's what it's about, right? So sometimes you think you know, but you don't know. And you don't know until you ask.
Yeah. Yeah. And I think you speak quite a bit about that joy, meaning, and fulfillment in the work that you do, but also in the work the team is striving to achieve. And I think that listening and hearing from our seniors and what they're looking for, because as you said, they deserve our respect and dignity in what they decide as well. So, in terms of like day-to-day services, how much have we changed in building that kind of community around our older adults or seniors that need our help?
I think that we have started now to develop a culture, at least in long-term care, which is where obviously I am from. We're starting to build that culture where we are listening to everyone, to the stakeholders, right?
Yeah.
So let me tell you, the most important, of course, is to listen to the seniors themselves, right? To the residents themselves. The second most important is to listen to their families.
Yes.
Because they all have a story. They know their loved one more than anybody else, right? And we don't have that information. We don't have that knowledge of what that person was truly like and what they truly love, right? But we also have to listen to the staff. And I think some of the major areas that we really need to focus on is, for example, in long-term care, we have care aides that actually provide care to our seniors, right? They are very connected to their seniors. So. And you know what? It's part of their family.
And relationship.
Exactly.
Yeah.
If a senior passes away, Victoria, right, the staff really feel it because, you know, it was part of them, right? And so this staff, you know, especially the care aides, they know the senior. So we have to listen to what they have to say. And that's not to say that we do not care for them medically.
Of course.
Right? I mean, you know, we do care for them medically. We want to manage their chronic illnesses, you know, in a way. But the focus is not on cure. The focus is on care, right? And
that's really important. Focus on care, not cure.
Right? Yeah. And a lot of the conditions that, unfortunately, you know, the frail seniors have, you know, have no cure, you know, but we can certainly care for them. We can certainly manage them. We can certainly make sure that the illnesses that they have are not in any way impacting their quality of life and the meaningful the meaning in life that they need, the purpose in life that they need. This is the most important for them at that time. So yeah, I mean, we have, you know, we care for them medically. We do what we need to do, but we want to go beyond that. We're not stuck at the level of the medical component. We want to go to the human and spiritual component of the lives of people.
And that's one of the areas that you have been engaged in terms of spirituality and that seniors care and end of life sometimes as well. So how do you see that manifest in the work that you do now, whether it's here or abroad?
One of the things that we have, continued to focus on is moving beyond just the medical, but understanding that spiritual and emotional needs actually also impact the physical medical component as well, right? And the medical physical component impacts the spiritual. So there is an integration. So if you, for this population, do not address the person as a whole, then you're not providing good care.
Didn't ask this earlier, but I'm curious when and why you joined Fraser Health specifically.
Because I've always wanted to change the system.
Yes.
I always wanted to make sure that I felt that if I could contribute towards changing the system and the way that we care for our residents, then for me, that would be something that would be worthwhile. The opportunity really came up in Fraser Health. And it came up in Fraser Health in a way where, I was really given, I was given the opportunity to make the changes that I wanted to make, right? And obviously within parameters, but it was inspiring, right, for me to be able to do that. And so it wasn't going to be just the same old medical administrator who was just going to make policies and rules and regulations. It was an opportunity to change the system.
And really the impact again and difference in the area of passion that you care about. So.
And Fraser Health was it's a huge, health authority, right? Yes. And so, because of the vastness of Fraser Health and the amazing thing that really got me interested was how different it was within Fraser Health in different geographic areas.
The diversity within.
The diversity of the population.
Yeah.
The diversity of the culture. We could have something very rural as, you go way east.
Kenyan and Hope.
Exactly.
And
when you go way east to, if you're in, New West or Burnaby or, Surrey, it's very urban. So, it allows you to really look at the whole continuum.
Yes.
And how change can be so powerful when you look at this continuum and you're able to make systems change throughout the continuum based on what different cultures, diversity that you are facing. So that's the challenge that really inspires.
Yeah.
Right?
Quite an exciting area of work, right? Yeah. And dynamic.
Very dynamic. Everything is different. There is no cookie cutter approach.
No.
Right? It's all different, right? And so that makes it very exciting, right? It's dynamic.
Never boring.
Never boring. It's different every day.
What do you foresee for our future to sustain our health services to provide that whole person care for our seniors?
I think that we are woefully inadequate in investing into the community system. And I think that every time we look at a need, we are very acute care centric. Now, I absolutely, I understand completely we need more cardiac catheterizations and defibrillators, and I get it. I understand all of that. But until and unless we actually invest in the community system, we're not going to shift the system, right? And we really need to start looking at things differently. So let me give you an example. So one of the things that I'm really excited about working on, we know that we need thousands of long-term care beds, for example. We know that. We also know that we're not going to get it. We just don't have the real estate, to get it. It's not just about funding. We just won't get it. So how do we start looking at this differently?
Exactly.
So one of the concepts that I'm working on is a concept called nursing home without walls.
Oh, okay.
Okay. So the nursing home without walls concept is a concept where a center for excellence that we're building, we've actually built one that we've just started in Chenchensuay, right, in Burnaby, where we have a center for excellence, where that is a center that will do, cutting edge research, training, in medical training, as well as, allied health and nursing and so on and so forth. Hopefully with very close connection with SFU, especially with the new medical school coming up and so on and so forth, where that hub now becomes a center point of providing services to seniors in the community who are already designated to come into long-term care.
Okay.
But they just can't come yet because there are no beds available.
Yeah.
So how can we provide that service to them in the community whilst they're waiting to get into the system? Now, if you look at the models, there are some models across the world that have worked on this. We will do our own. We will tweak it because we want to be different. We want to be better than everybody else.
Yeah.
But what that will allow us to do is to keep that senior in the community longer by providing them care that they would need in a long-term care community, by providing that care to them in the community, having them come to the care community during the day, participate in programs,
some of the
activities and so on and so forth. And what that will do for them is that when they transition, when the time comes and they transition into the care, they will actually have a very seamless transition because they will have known that care community, they would have been part of it, they would have been part of the activities and so on and so forth. And even the staff will have a much better experience with this new person coming. So the whole concept of, palliative approach to care, quality of life, and all of that, we would have done all that work for them, right, prior to them actually coming. And we have seen that, this kind of a nursing home without walls concept can actually delay admission into long-term care by more than 2 years.
Wow.
In a person who was already designated to come. So we got to start looking at things differently.
Yeah.
Because we cannot just always sit down and say and complain, oh, we just don't have enough beds. Well, we just don't have enough beds. Well, I have news for you. We're never going to have enough beds. We just need to do it differently.
Yeah.
And so we need to start thinking innovatively on how we're going to address this in a different way.
Yeah. Well, that's why you're a pioneer. You're looking at best practices, you're adopting, you're adapting to our setting, and then challenging us to actually find solutions for future, now and future. So,
well, I'm fortunate that I have a really good team.
We do have wonderful teams.
Wonderful
around.
people, wonderful leadership.
Yeah. One last question for you. One thing you wish people knew about healthcare?
What they need to know is how important prevention and lifestyle is in order for you to not require, the complexities of the system at a time when you probably should not need it. And I think part of that is understanding how we need to really focus on prevention and lifestyle measures. For me, that component of healthcare is perhaps the most important. We're very good at looking after people when they enter our system. Honestly, we are. We're really good at looking after them. But I think what we really, need to focus on is how we should be able to prevent ourselves in perhaps some of those chronic medical illnesses that we end up suffering from, that requires us to access healthcare systems in different way. How we can actually do our part in healthcare to make that system better.
Well, thank you for your insights, your expertise, words of wisdom, and sharing your passion and how your journey into Fraser Health and being heart of Fraser Health and being heart of healthcare. Thank you for being with us.
Thank you so much. Thank you, Victoria. It was a privilege. Thank you.
That's all for today on the Heart of It podcast. Join us next time as we continue to get the heart of healthcare. And please don't forget to subscribe and rate this podcast. The Heart of It is a Fraser Health production. I'm Dr. Victoria Lee, your host. Vanessa Wasno and Kevin Smith are our producers. Recording and editing is done by Fraser Health Communications and Public Affairs.